Known for his charm, humor, and iconic roles in movies like Deadpool, Ryan Reynolds has been in the spotlight for many years. Has Ryan's facial transformation been purely natural, or could it be the result of plastic surgery? Estimated costs are revealed later on, so make sure to stick around till the end of this video. In 1998, at the age of 22, when we look at Ryan's forehead, we see that it's proportional to his middle third and lower third of the face. But we do see some lateral extension to his forehead, and that's due to a few factors. One is the angle of his upper temples. The way that they sit allows more lateral forehead to be visible. Another is that he has a prominent lateral frontal bone, and we see that with the curvature of his lateral forehead. For that lateral frontal bone prominence, some people look to address that with various options. There are people who get HA filler to smooth out that area. Also, some people get fat transfer to that zone to again create more of a smooth appearance. And then there are people who shave down the actual bone to make it look a bit smoother and more seamless with the lateral portion. Most of that is completely unnecessary, and the majority of people don't even notice that they have that bony prominence in that location. When we look at Ryan's eyebrows, they appear thick, flat, and they rest right on the brow ridge, which is very standard in men. And he does have a few thinner spots along his eyebrows, more on that later. In analyzing Ryan's nose, we see that the bridge is quite narrow, flat, and the tip is slightly bulbous. When I look at his lips, I see that the philtrum and the cupid's bow are both well defined. In 1999, at the age of 23, what I want to point out here is that there's an obtuse angle of his frontotemporal corners. Some patients ask me to reduce that angulation when we do hair surgery, and one way to do that would be to lower the hairline, but another is to just bring in the temporal element. So you can actually leave the hairline height in a natural position, but just bring in the temple slightly and close down that corner if that's the goal. When we look at Ryan's eyes, we see a smooth lower lid to cheek transition. And looking again at the lips, what we see here is that there is some upper tooth show on repose. So when he just parts his lips like this, you can see that there's a little bit of upper tooth show visible. And he has close to a 1-to-1 upper to lower lip ratio. And when we look out towards the oral commissure, on Ryan's upper lip, we see that there's some upper lateral lip hooding. And what lateral hooding of the upper lip means is that as we look to this area here, we see that there's skin visibility in this location all the way down to the vermilion border, and it almost covers a portion of the upper pink lip. Other people will have pink lip visibility all the way out to the oral commissure itself, but some people have this lateral hooding, and that's just a normal variant. For people who are looking to address that surgically, the way that's treated is usually with a corner lip lift. And when it comes to corner lip lifts, one of the biggest downsides is of course the scar that you get along the vermilion border. There's also the potential of creating some additional asymmetries of the lip, but it is a viable option for patients who understand these risks and who have goals that are in line with their anatomy and what is possible with the corner lip lift procedure. And I do have a video where I discuss the corner lip lift in a lot more detail, so if you're interested, please make sure to check out that video. And when you're placing filler into the lip corners, you have to of course be mindful of potential migration of that filler out of the pink portion of the lip and into the cutaneous portion of the lip. It's also possible to build up just the pink portion of the lip without creating enough eversion that would make that filler into the lip worthwhile. But again, this is a normal variant that usually does not bother people. In the year 2000, at the age of 24, Ryan is now developing some upper lateral eyelid hooding. So a little different than the upper lateral hooding that we were discussing related to the upper lip. When we look at the upper eyelid, we can also see lateral hooding. Sometimes that exists from an early age, just the way that the skin is positioned, and other times you start to see this hooding as you age. And of course, with the aging process, there's gravity and everything tends to drop, and that frequently occurs in the lateral portion of the upper eyelid. Ryan also has a strong mandibular structure, so when we look from the gonial angles all the way down towards the chin, there's good strong prominence of bone. And Ryan's face is quite symmetrical, but when we look at his ears, we can notice that the left ear protrudes a little bit more than the right ear. And that's very common in men and women, where one side sticks out a little bit more than the other side. And he has these small areas on both eyebrows that appear a little bit thinner. And there are a few options here. One, of course, is to do nothing because it still looks really good. Another option is to do something called microblading, where ink is placed in these types of linear strokes to simulate natural eyebrow hair. Yet another method to cover up some of those areas would be just simple makeup. Some people use that to make the eyebrows appear thicker. And of course, some people come to me for eyebrow hair transplants, and that's where we're actually taking hair, usually from the back of the head, and transplanting it into these thinner areas to make everything look a bit more homogeneous and thicker. But there are some issues with just transplanting these isolated areas versus doing a hair transplant to the eyebrows, where we work more diffusely and extensively on the eyebrows. One of the issues is that you can sometimes see that contrast between the transplanted hair and the natural hair that exists in the location of the brows, especially in people who have finer, straighter hair at the eyebrows, but then their scalp hair can be quite curly. Of course, there will be some mismatch there. So oftentimes when we work on the eyebrows surgically, it's better to spread transplanted hair more diffusely rather than only focus on select areas of the brows. In 2001, at the age of 25, I see no change, and that's the same through 2003. In 2004, at the age of 28, I wanted to highlight some of Ryan's beard characteristics. When we look at his central mustache, specifically where the philtrum is, we see that there is some hair missing there, and that's extremely common. And even when we go in and transplant that zone right there, oftentimes the regrowth rate is rather low, and we typically have to come back into that area a few times to bump up the density of hair in that zone. He also has a thin mustache to cheek connection point. For some people, that connection is quite thick. In other people, it's that thinner connection. And yet in other folks, you actually don't see a connection at all. You can also appreciate the variable cheek height of his hair. Like when you look at the medial portion compared to the lateral portion, you can see some fluctuation of that height. And also the amount of hair in the goatee and soul patch area differs from person to person. So some people have a more extensive type of soul patch and goatee connection. Other people, like Ryan, have a soul patch, but it dips down towards the goatee area, and you have some areas here that don't have any hair. And that's a very normal variant, but of course there's going to be very different shapes and configurations to various beards. Since Ryan Reynolds was a child actor, we can look back at those photos and notice that Ryan did have a bit of crookedness to his teeth, and he had that central gap. He likely had some form of orthodontics, such as braces, to close down that gap and to have straighter teeth. Remember that braces can improve your jaw alignment, not just the teeth themselves. And that can change the appearance of one's jawline and their facial profile. But to me, it doesn't look like Ryan's had veneers, and it also doesn't look like he got his teeth overly whitened. So it comes off as very natural looking. And remember that Ryan Reynolds grew up in Vancouver. And in Vancouver, they do not add fluoride to their tap water. Fluoride can protect against cavities. So despite not growing up with fluoride in the drinking water, he still was able to have very good teeth. And the Canadian Dental Association recommends brushing with fluoride toothpaste to maintain healthy teeth. In 2005, at the age of 29, I see no change, and that's the same through 2012. In 2013, at the age of 37, what I'm noticing here is that Ryan's hair has not changed much since his early 20s. And this, of course, could just be his natural pattern. Some people experience experience some loss of hair in their late teenage years, early 20s, or even into their mid and late 20s, but then there's some degree of stabilization and they just ride out that pattern for decades and decades. But for most men, in order to keep your hair from progressing into more advanced hair loss patterns, they are often on finasteride or dutasteride of some form, usually a pill form, sometimes a topical formulation. We've spoken extensively about this medication in the past, and the way that most people are getting it these days is from feelconfident.com. This is a service that my team started in order to get you medications at the most affordable prices delivered directly to your door. So if you're interested in a service like that, and if you want to pay less than going to your local pharmacy, and also not have to worry about going in person to a doctor who will prescribe this, make sure to head to feelconfident.com to check out the options there. At 37, Ryan also has deepening tear troughs, so that once smooth transition from the lower lid to the cheek is now less smooth because there's a trough developing in this location, which is part and parcel with the aging process. In 2014, at the age of 38, I see no change, and that's the same through 2017. In 2018, at the age of 42, Ryan here is experiencing some brow ptosis, and as his brows naturally descend, there's now increased upper eyelid hooding. In severe cases, this can actually reduce your field of view, and some people get upper blepharoplasty and or brow lift procedures that are covered by insurance because they're getting it for a functional reason, which is that they can't see the way they used to see. So that is a very real approved reason for insurance to actually cover those surgeries. But many times those surgeries are done for purely cosmetic reasons, so of course insurance will not cover it in those types of scenarios. And in the past, people would just go in, remove some extra skin and call it a day. But nowadays we realize that it's very important to reestablish the natural position and height of the eyebrows before you go in and start to radically remove skin from the upper eyelid. Because oftentimes when you reposition the brows, you no longer need to remove that much skin from the upper eyelid. So it reduces that excision of skin, and that can actually give a much more natural look than overly hollowing out the upper eyelid, which can actually make the person look older than they did when they had a bit of hooding. And especially in men, you have to be very careful not to feminize the face by performing more exaggerated brow lifts and upper blepharoplasties. In 2019, at the age of 43, I see no change, and that's the same through 2024. In 2025, now at 48 years old, we see that Ryan's upper lip has lost some definition. As collagen and elastin fibers diminish with the aging process, we tend to get thinner lips that appear a bit less hydrated. But overall, I think Ryan looks great, and he's been in action movies for like the last 20 years. And we know that regular exercise can actually boost your overall collagen. And it does this in a number of ways. One is through mechanical stimulation. Mechanical loading on tissues actually stimulates collagen production. Another is through improved circulation. This can enhance the delivery of nutrients like vitamin C and various amino acids, and those in turn are needed for collagen synthesis and tissue repair. With exercise, we also see growth factor release, such as increased concentrations of IGF-1. In his late 40s, Ryan's imperfections add to his charm visually. That's something that gets lost in modern social media, where everything is filtered down to perfection. Unique features influence how people see us and make us memorable. But many people recently have been saying that Ryan just looks more tired. Why is that? I mean, we did talk about the increased eyebrow and eyelid ptosis, and also he has a bit more wrinkling developing around the eyes. That can surely give off a bit more of a tired appearance. But we also know that more stress and less sleep can, of course, contribute to a more tired appearance. Living in the public eye is never easy. And so, it ends with $0 spent on plastic surgery. See what I did there? Do you agree with this assessment of Ryan's face being au naturel? Let me know in the comments below, and keep it kind.